Hey everyone, ready for a deep dive into something, well, kind of unexpected. We're going to be talking about hernias.
Hernias, yeah. And get this, they actually start way back, like before we're even born. It's all connected to this thing called the inguinal canal.
Okay, see, inguinal canal, that's where I tend to tune out. It sounds like something from anatomy class that I promptly forgot.
It is from anatomy class, but trust me, it's way more interesting than it sounds. Imagine, right? You're a fetus, just a few weeks old, and parts of what will become, your external genitalia, they actually start developing up in the abdomen.
Hold on, wait, they start up there.
Yeah, up in the abdomen. And as they make their way down, they got to carve a path through the abdominal wall, right? That path, that's the inguinal canal.
Wow, okay. So it's not like some random tube. It's literally the path our bodies take during development. That's kind of wild.
It is wild. And here's the thing, it's not just an empty space either. Our source, they describe it as a rounded cubic prism. So picture a cube, but with those edges kind of smoothed out, running right through your abdominal wall.
Okay, I think I'm starting to get it.
hmm
But so everyone has this canal, right?
hmm
Why do some people get hernias then? What's going wrong there?
Excellent question. It all boils down to what's inside this canal and how strong the canal itself is. So in males, you've got the spermatic cord going through there. For females, it's the round ligament of the uterus.
Okay.
And both men and women, we've got the ilioinguinal nerve running through there too.
Uh-huh.
Now think about anytime you lift something heavy, cough, even just stand for a while, you're putting pressure on your abdominal wall, right?
Right, makes sense.
And that inguinal canal, right in the middle of all that action.
Oh, so like right where all that pressure is.
Yeah, exactly. And sometimes that pressure is just too much for the canal to handle, especially if there's a weak spot. Now, those weak spots, they can be there from birth, like something called a patent processus vaginalis, or they can develop over time. Age, strain, even genetics play a role.
Okay, hold on. Let's unpack this patent processus vaginalis because that sounds kind of intense. What is that, and why would it make the inguinal canal like vulnerable?
So think of it this way. When you're developing, right, there's this little pouch that helps guide the testes down to the scrotum in males.
Right.
Normally, this pouch closes up after birth. But imagine it's like a zipper that didn't completely seal. That opening, that's the patent processus vaginalis, and it creates a weak point in the abdominal wall.
So instead of a nice strong wall, you've got a potential escape route for your insides.
Exactly, like leaving a side door open. And that's how you get an indirect inguinal hernia abdominal contents. They can actually sneak through that open door, that patent processus vaginalis, and even end up in the scrotum.
Whoa, okay. So that's one way a hernia can happen?
Yeah.
What about those weak spots that you said develop over time? What causes those?
Right, so the inguinal canal, it's well designed and all, but it's not invincible. Aging, repetitive strain, like lifting heavy stuff all the time, even chronic coughing, those can weaken the muscles and tissues making up the canal walls.
So it's like just wear and tear in your body, basically.
Exactly. And when those walls weaken, that's when you're at higher risk for a direct inguinal hernia. Now, this type doesn't use that open door we talked about. Instead, it's more like imagine the pressure of your abdominal contents just pushing directly through a weak spot in the abdominal wall near the superficial inguinal ring.
The what ring?
Superficial inguinal ring. Think of it like a bulge pushing through a tired, stretched out piece of fabric.
Okay, I get it. So two different types of hernias, both involving this inguinal canal, but kind of with their own ways of like developing. That makes me think the location of the hernia within the canal matters, right?
You are spot on. Our YouTube doctor, he points out these blood vessels, the inferior epigastric vessels, as a key landmark. Picture them like a dividing line running near the inguinal canal. An indirect inguinal hernia, the one using that open door, usually pops up on one side of these vessels, like it's taking a detour around a river.
Okay, I'm with you.
A direct inguinal hernia, though, it's more like a bridge collapsing. Pushes through the abdominal wall, but on the other side of those vessels. And this difference, knowing which side of the river the hernia is on, is huge for doctors when they're figuring out the best way to treat it.
So it's like two totally different construction projects. You wouldn't fix a bridge the same way you'd reroute a detour, right?
Exactly. And just like any good construction project, you want the right tools and techniques for the job.
Makes sense. This is way more interesting than I thought it would be when we started. This tiny city thing, It really makes sense. Like if things start going wrong in there, we're not just talking about, medical terms. We're talking about real symptoms people feel.
Oh, absolutely. And those symptoms, they can be all over the place. Some people, they might see a bulge, like in their groin area, especially when they cough or something. Others, they feel this ache or pain, kind of dull, might get worse if they're active.
Right.
Some people even say it's like a burning or dragging feeling.
Yeah, okay. Yeah, no, that's definitely not something you want to just ignore. But it makes you wonder, why is this area so prone to hernias in the first place? Seems like a design flaw almost.
It's a great question, and it all comes back to this balance our bodies have to strike between form and function. Like, remember how we said the inguinal canal, it's got to be strong but also flexible.
With like a busy intersection, right, in our abdominal wall.
Exactly.
Yeah.
Busy intersection. And just like with those, it's a point where things can go wrong. That need for flexibility means those tissues there, they're naturally going to be weaker than, say, a bone or something. Plus, think about it, this area, it's always dealing with pressure. Standing, walking, lifting, all that everyday stuff.
So it's like a perfect storm almost. You've got a weak spot, and then you're adding all this stress on top of it. But if we know that's the why, shouldn't we be able to prevent it somehow?
You're thinking like a true deep diver here. And the answer is yeah, to some extent. Like, we can't change our anatomy, right? But we can minimize those risks that we can control. Our YouTube doctor, he's big on this healthy weight, using proper lifting techniques, even eating enough fiber so you're not straining when you go to the bathroom. All that stuff can actually make a difference.
So it's about, like, respecting that area, being mindful that it's vulnerable.
Exactly.
Okay, so let's say a hernia does develop. Our source talked about using those blood vessels, the inferior epigastric vessels, to tell the types of hernias apart. How does that work, and why is that so important?
Perfect question. So those blood vessels, think of them like a landmark, like we said, like a river running through a city, okay? An indirect inguinal hernia, the kind that goes through that little open door from when we were developing, it usually shows up on the lateral side of these vessels, like it's got to take a detour around the river.
Okay, got it.
A direct inguinal hernia, though, it's more like that bridge collapsing pushes through the abdominal wall, but medial to those vessels, often because of weakened muscles or too much pressure inside the abdomen. And this is key. Knowing which side of the river the hernia is on, that helps doctors figure out the best way to treat it.
So going back to our construction analogy, you wouldn't fix a bridge the same way you'd, reroute a detour. Makes sense.
Precisely. Just like with any construction, you gotta use the right tools and techniques for the job. Like, for an indirect hernia, especially in kids, sometimes they can just close off that patent processus vaginalis. Remember that zipper we talked about?
Yeah.
It's like zipping it up.
Makes sense? So not every hernia needs major surgery.
Not always.
Yeah.
But sometimes that opening is bigger, or there's a chance the hernia could come back. That's when a surgeon might use surgical mesh.
Mesh, like a patch.
Yeah, like a strong patch. Gives the weakened area extra support.
Okay, so we've got our patching system. What about the direct hernias? Those are the bridge collapses, right?
You got it. And because direct hernias, they involve that weakness in the actual abdominal wall, they usually need a different approach. Often, they'll use that surgical mesh too, but to strengthen the wall itself, prevent that hernia from coming back, like reinforcing the bridge supports so it doesn't happen again.
So whether it's zipping up the zipper or, reinforcing the bridge, it seems like the main thing is to make that abdominal wall strong again.
Exactly. Give those areas that extra support, whether it's natural or we gotta, give it a little help with the surgical mesh.
This has been, honestly, way more interesting than I thought it would be when we started. I went from, barely remembering what an inguinal hernia even was to, understanding the how, the why, even the different ways surgeons fix them. It's amazing how something so common can be tied back to, literally how we developed.
Right. The human body is full of those little surprises.
Yeah.
And honestly, the more we understand how our bodies work, the better we can take care of them,
Absolutely. Before we wrap up, though, one thing I was wondering, is there anything specifically for men that they should, watch out for, just given, how their anatomy works down there?
That's a really good point because, you've got the spermatic cord running through the inguinal canal in men. So any changes in that area, sometimes it can be related to the testicles too.
Oh, okay.
Yeah, like testicular pain or swelling, that kind of thing. Sometimes that can actually be a sign of an inguinal hernia, especially
Really?
early on. So guys, especially really pay attention to anything weird going on down there. Don't just ignore it as oh, it's just groin pain.
Yeah. When in doubt, get it checked out.
Exactly. Early detection is key with these. Always better to be safe than sorry, right?
Absolutely.
Yeah.
Wow, so interesting how something that starts way back before we're even born, this little canal, can really impact our health.
It is pretty amazing when you think about it.
Makes you wonder what other hidden connections are in there,
Yeah.
right? But for now, I think we've successfully navigated the ins and outs of the inguinal canal. Any final thoughts for our listeners before we sign off?
Your body's always talking to you. Pay attention to those aches, the weird twinges, all of it. Something doesn't feel right. Don't wait. Go talk to your doctor.
Love it. On that note, we'll leave you to ponder the wonders of your own, internal universe. Until next time, Deep Dive Partners.